Hey, this is Dr. Dan from Vibrant Health Chiropractic Care, right in Dumbo, Brooklyn, New York. Today we're going to be talking about the low back and what causes some of those low back issues and also how we assess it. There's three major things that we focus on in this office. The first being proper alignment. We want to see that the spine is nice and straight up and down, that there's not any twisting or anything's jammed and stuck out of place. The other thing that we look for is proper curves. We want to see that we have these three major curves in the spine because they offer shock absorption as well as the body's ability to start to dissipate the forces and the stresses and the strains that we experience on a day-to-day basis. The next thing that we look for when it comes to the spine is the muscles. Now, there's two major problems when it comes to the muscles. One, there can be spasm, tight muscles, muscles that are stiff and restricted, or the muscles can be too weak. Either one is a problem because it's not going to be supporting the body and the hard tissue or the bones as well when that is the case with the muscles. Last but not least, in fact, probably one of the most important components that we focus on here that not everybody does are the discs. The discs are the shock absorbers of the spine. They separate the vertebrae and allow our bodies to flex and move and groove and do all the things that we're designed to do. And in fact, we need that motion to nourish those discs and keep them healthy and plump. One of the unfortunate situations that can occur that we hope that everybody avoids is disc degeneration. Now, the disc is surrounded by fibers. It's a round, plump pancake with a gel at the center. And what can happen is those fibers start to tear or break down and the nucleus will start to displace. Sometimes that nucleus can displace bad enough that the disc actually starts to bulge or herniate. And that's not a situation we want to see our patients getting into. In fact, taking care of the problem earlier on will help prevent disc degeneration, will help prevent the disc from breaking down or herniating. And that's where we prefer our patients to be. When there's proper alignment, though, you can see even when there's a disc problem, we're still getting good signal. But as the disc or as the joint gets stuck or moves out of place, it starts to interfere with those signals and causes a breakdown in the communication, which is not good and something to be avoided. That's why we find it very important that we focus on the disc and correcting that situation. When it comes to correcting that situation, that's going to be for another video, but if you know anybody that's experiencing any back or disc problems, send them in, send them a link, give us a thumbs up. If it's you yourself, give us a call. We're here to help.